Hello, I'm Kay, the nurse recruiter.
Catherine, nice to meet you.
You're welcome.
This is my resume for you,
Thank
and
you.
I have a paper portfolio still.
Oh,
I'm in the process
wonderful.
of making an online one.
Wow, this is great. Thank you.
You're welcome.
All right, well, can you go ahead and just tell me a little bit about yourself?
Okay. I live in the Winchester area for now. I'm getting ready to move out towards Harrisonburg, so this is an ideal hospital for me.
Wonderful.
The only girl in my family.
Oh.
And baby. So, yeah, that's a little bit.
Good. Okay. Can you tell me where you would like to see yourself in 5 years?
Ideally, I want to go back and get my master's. I want to work for about a year at least and then go back to school, get my master's, and start teaching. The ultimate goal is nursing education, but I would want to stay in practice while I did that. I wouldn't want to just get the year experience and then leave. I'm looking for a job that I can also have while I teach.
That's wonderful. That's quite an ambition. I like it. What would you say is your greatest weakness?
I come off a little quiet and reserved, and I think a lot of people overlook that and think, oh, well, she's not gonna speak up when she needs to, or things like that. And I don't see it that way. I know it comes off like a weakness, which is understandable, but I'm very observant and detail oriented, and I feel like that works to my advantage to be quiet because I'm observing and I'm paying attention to the things that I need to, and I do speak up when I need to. So it's a strength, but also a little bit of a weakness.
Nursing is definitely something you need to have that detailed attention for.
Yes.
I think that's important. In your last job, when were you most satisfied?
It has nothing to do with nursing skills, or although I do love like blood draws and the skills that come with being a nurse, but the things that make me most happy are when patients actually show improvement, or when patients even just come back and say thank you. Or there was, when I was in the NICU recently, there was a patient that asked me to take a picture with her baby because they were getting ready to go home, and I've been on that case the whole time, so I've gotten to see the progression of how the infant grew and got better, and now they get to go home. And
great.
So little things like that, like it means a lot for the family because that's something that can go in the baby book, but
Absolutely.
that means a lot to me too. Like it's an honor that they would want to include me in that. So
Great.
it's little things.
That's wonderful. Well, those are the only questions I have for you today, but are there any questions that you would like to ask me?
I do actually.
Okay.
Things that I'm curious about are where the open positions are.
Okay. Well, we do have some on, we have a cardiac, like med surg floor that we are looking for in neuro. And we also have mother baby that we have open.
Okay.
I know you said that your preceptorship was in the ICU or the NICU, so I don't know if that might be interesting.
I'm very malleable. I can be happy.
Oh, that's wonderful. But we would like you to be somewhere that you would enjoy.
Yes, and that's key. I think is happiness. And is this a fellowship program or?
We actually do not have a fellowship program. We do have an orientation that you'll go through, and then you will follow a nurse on the floor before we assign you to your own patients.
How long is the orientation?
3 months.
Okay. And if I felt after 3 months that I would like an extension on that, would that be something?
Absolutely, absolutely. We want to make sure that you feel comfortable to provide the best care to our patients.
Okay.
So that's definitely important to us and an option for you, of course.
Okay. Good.
Sure.
And it's how high is the turnover rate for nursing? I know that's a sticky question, but.
Well, it does depend on what floor that you end up working on.
Okay.
But our turnover, we used to have a high turnover, but we've really focused on what we needed to change, and we've focused on changing our leadership a lot so that we can keep some of our nurses longer. And we've seen the turnover go down, so we're really moving towards, we have a focus on that right now.
Okay. Wonderful.
Okay.
So when would I expect to hear something back, good or bad?
We're still doing interviews, but I'd say in probably about 30 days we'd be able to let you know.
Okay.
Either way.
I think that's it. That's all.
All right, wonderful. Well, it was very nice meeting you.
Thank you very much.
Absolutely.
Have a good day.
Thank you, you too.